Frequently asked question about anesthesia. 3. Frequently asked questions leaving. During anesthesia, how can I breathe? The operation room experience. Will I remember the operating room experience and the pain in this operating room? Welcome. In this course, we speak about anesthesia as a science, as a responsibility. General anesthesia induces a state. This state is much better than sleeping. We place a patient in a reversible coma. We paralyze the patient if the muscle relaxation are required. If a breathing tube needed to be used is responsible for managing the breathing. Pain prevention is an important aspect of the care. Before the end of the surgery, painkiller will be produced, good pain relief will be given. The definition of the anesthesia: it's a reversible drug-induced state of unconsciousness which is characterized by coma-like state under the control of the anesthetist or anesthesiologist. The history: before 1846, there was no way to provide anesthesia to the undergoing surgery. Surgery was extraordinarily painful, bloody, and dirty. Surgeons were praised for their speed, not for their skills, for success in successful completing an operation. From 1853 to 1890, the Massachusetts General Hospital provided surgical procedure to an average of 5 people per week, 260 people per year. Now over 100 procedures are done per day at the same hospital. It's all thanks to the dentists who began the anesthesia. Horace Wells, the real father of anesthesiology, he is a dentist. In 1844, attended a party and observed that party participant who breathed nitrous oxide didn't seem to suffer pain when injured. It was her leg lacerated and she didn't feel that pain. In 1845, Wells had a tooth extracted under nitrous oxide anesthesia. January 1845, demonstration of nitrous oxide for surgical anesthesia at Massachusetts General Hospital, a dismal failure. Nitrous oxide is not anesthetics. It's a very good analgesic. Inhale it, either laugh, sing, dance, speak, or fight. According to the leading trait of their character, they seem to retain conscious enough not to say or do that which they would have occasion to read. In 1845, William Morton, another dentist, successfully demonstrated the use of ether for excision of a neck tumor at Massachusetts General Hospital. The picture of Morton when he introduced ether. John Snow and obstetrical anesthesia. April 7, 1853, Queen Victoria received a chloroform during the birth of her 8th child. Dr. Snow administered the drug. He was the father of anesthesia and the father of epidemiology. Here is the mask for ether, the old mask for the ether, and the spinal anesthesia is the common form of cesarean section, whereas epidural anesthesia is useful for pain relief during labor or after surgery. Anesthesia safety: one of the safest intervention in the modern medicine, but in the developing country there is still a challenge. 1 to 10,000 mortality rate for general anesthesia, 1 to 100 rate of permanent neurological damage for spinal and epidural anesthesia in developed country. You can't find this course structure: introduction to anesthesia, introductory physiological effect of anesthesia, drug used in anesthesia, anesthetic systems, general anesthesia, regional anesthesia, emergencies, intensive care, pain management, anesthesia for pregnant patient, children and elderly, anesthesia and other medical disciplines.